So on both of our campuses combined, we've had about 8 patients that have had, culture confirmed group-based streptococcal infection, and they've all been treated successfully and improved, but some have been pretty sick, requiring, even intensive care hospitalization. It's very rare, and it still is very rare. We have been seeing a little bit more of it, and I think it's important to define what invasive means for the parents and families at home. Invasive just means you're seeing germs in parts of the body you don't normally find them. So you'll see them in the bloodstream, you'll see them in the lungs, you might see them in the joints. So you don't typically see that. Now, what makes you more predisposed to getting this? One of the thoughts right now is that we had a big respiratory viral surge, and with all those increasing viruses, if you get an extra infection with group A strep, the virus itself may be suppressing the immune system, and it also is irritating the protective lining of things like your mouth, your nose, your throat, and that may be allowing that group A strep to sneak in because it's got a little doorway in. The other thing is potentially that group A strep is a little bit different or stronger than ones we've seen in the past, because we have seen invasive infections in the past, but not like this. So that's also a possibility. For the first thing is the normal common sense things that require immediate attention. But if your child is all of a sudden not really responsive to you, not speaking like they normally would, etc., then you're going to want to go to seek care right away. The other things are if they've had a virus that they were diagnosed with by their pediatrician and they're not getting better or they're getting worse after about 5 days. And the other thing is you look at their skin. If they're having red, warm, swollen, painful skin, especially in an area where it may have been disrupted by a cut or a scrape, or it's oozing something, you want to seek care for that because that's another area where strep can get in and cause things like cellulitis. Or if they're complaining of pain in an extremity, that's swollen or red, or they just don't want to use it, they won't bear weight, or it's too painful to move, that's something you want to seek prompt attention for as well. So, the things you want to do is look at basic penicillin is the key for that, supportive care, IV antibiotics, IV fluids, you may need blood pressure maintenance medication, etc. in an intensive care setting, but it's antibiotics that will help. That supportive care and the antibiotic therapy typically turns most patients around and they go home.